Hello everyone, welcome to Jessie's MedBio. In today's section, we are going to discuss about two topics. First one is morbidity and mortality rates. Second one is difference between children and adults. So, firstly, we are going to explain about the morbidity and mortality rates. So, the first one is morbidity measures. Under the morbidity measures, two measures are coming. That is incidence rate and second one is the prevalence rate. Incidence rate means it is the number of new cases only. But the prevalence rate means it is the total number of existing cases. And how we are calculating means incidence rate is equal to number of new cases of a disease during a specified period divided by population at risk during the same period into 1000. Then prevalence rate means it is the total number of existing cases of disease at a specified time divided by the population at the risk into 1000. This is about the morbidity measure. Then second one is the mortality measure. Under the mortality measure, around 7 measures we can able to see, that is death rate, maternal mortality ratio, perinatal mortality ratio, neonatal mortality ratio, post-neonatal mortality ratio, infant mortality ratio, under 5 mortality ratio. So first one is the death rate. Death rate means what? Total number of death. So here how we are calculating is total number of death during a specified period divided by total population at the same time into 1000. So the second one is maternal mortality ratio. Maternal mortality ratio means the number of mothers who had died during the period of pregnancy, childbirth or within 42 days after the delivery. So how we are calculating is maternal death due to pregnancy, childbirth or within 42 days of delivery divided by total live birth in the same year into 1000. Then third one is perinatal mortality ratio, which includes all the late fetal death along with the early neonatal death. Early neonatal death means the newborn babies who had died within 7 days after the birth. So the calculation is late fetal death plus early neonatal death divided by total live birth into 1000. So the fourth one is neonatal mortality rate. Neonatal mortality rate means it is the number of newborn babies who are died within 28 days after the birth. So the calculation is death of infants under 28 days by total live birth into 1000. Then fifth one is post-neonatal mortality rate. Post-neonatal means the infants aged from the 28 days to below 1 year or up to 1 year of age. So the calculation is death of infants aged 28 days to below 1 year divided by total live birth into 1000. Then sixth one is infant mortality rate. Infant mortality means the number of infants who had died under the age of 1. So the calculation is death of infants under 1 year divided by total live birth into 1000. The last one is under 5 mortality rate, which means number of children who died under the age of 5. So the calculation is death of children under 5 years divided by total live birth into 1000. So these are the mortality measures of the child. So next we are moving on to the topic, that is difference between children and adults. Under this mainly 4 differences are there. So first one is anatomical and physiological difference. Second one is psychological difference. Third one is immunological difference. And fourth one is social difference. So first we are going to see about the anatomical and physiological differences. So under the anatomical and physiological differences, first one is general body structure. In that the children is having smaller size and weight than the adults. And also the newborn's head is larger than their body. Then their muscles are less developed and also their body fat distribution is different. Then their growth is very fast during the infancy period and the childhood period. Then second one is the integumentary system or the skin. Then children's skin is very thin and soft, delicate and more permeable than the adult skin. And their sweat glands were immature, so the children cannot able to regulate their body temperature properly. Their sebaceous glands were less active, and also their skin is easily injured and infected. That is about the integumentary system. Then third one is the respiratory system. Under the respiratory system, their airways are smaller and narrower than the adult. Their alveoli are fewer and less developed. Their respiratory muscles were very weak. Their respiratory rate is higher than the adult, and they are having less mucus production, which reduces the protection against the germs or the infection. Then fourth one is cardiovascular system. Before the birth, blood circulation occurs through the placenta from the mother to the fetus. But after the birth, fetus circulation changes to normal circulation as the adult. Then heart rate is faster in children than the adult, but their blood pressure is lower than the adult. That is about the cardiovascular system. Then next one is the hematological system or the blood. The newborn RBCs are larger than the adult RBCs. Then RBC's lifespan is 60 to 80 days when compared to the adult. For the adult, the RBC lifespan is 100 to 120 days. Then the hemoglobin changes from fetal to adult type after the birth itself. Then next one is the fluid and electrolyte balance. Total body water is 75 to 80% in newborns when compared with the adult. For the adult, it is only about 60%. Then their kidney and the hormonal mechanism are immature. Then electrolyte imbalances which develops very easily, like hyponatremia or hypokalemia or hypocalcemia. These kind of electrolyte imbalances will develop in children very easily because of their immature system. Then next one is the gastrointestinal system. Under that, the digestive organs are immature at birth. Then the cardiac sphincter is weak. It will cause the regurgitation and the vomiting. Then enzyme production and digestion will improve according to the age. Then next one is the urinary system. Urinary system means the kidneys are immature. Then they are having very poor ability to concentrate the urine, and frequent urination is normal in the children. Then next is endocrine system. Endocrine system means their hormone secretions were not fully developed, and also the hemostatic control of the glucose, fluids and electrolytes is immature. Then next one is the reproductive system. The reproductive organs are present but they are immature. The puberty begins around 10 to 13 years in girls, and in boys it is from 11 to 14 years. Then musculoskeletal system. Musculoskeletal system means their bones are very softer and more flexible than the adult. Then their skull sutures and the fontanelles remains open in infants. Then their bone heals faster than the adult. If any fracture or any injury is happening at that time, their bones get healed faster than the adult. Then the growth occurs through the epiphyseal plates. Then next one is the neurological system. Brain grows rapidly during the first year of life. Then primitive reflexes were present like rooting reflex, sucking reflex, Moro reflex or grasping reflex. These kinds of primitive reflexes were present at the birth itself. The nervous system matures gradually. Then lymphoid and immune system. Immune system is immature at the birth. Maternal IgG antibodies provide temporary protection. Lymphoid tissue enlarges during the childhood time. That is about the anatomical and physiological differences according to the system wise. Then we are moving on to the psychological differences. In psychological differences, first one is limited understanding of illness. Infants and young children do not understand the cause or seriousness of the illness. They focus mainly on the immediate pain and discomfort rather than the disease itself, which means they are not aware about the disease condition. They are mainly focusing on the pain and the discomfort they are facing. The next one is the unable to express symptoms. Infants cannot tell the nurse what they feel. As a nurse, it is our responsibility to identify the symptoms by seeing their changes in their expressions like crying, irritability, poor feeding and all. Then third one is short attention span. Children live in the present and easily forget unpleasant experiences. Their attention can be diverted through toys, stories or play. However, distraction reduces fear but does not remove the pain. Then fear of hospitalization. Young children fear hospitals, injection and unfamiliar people. Separation from parents causes separation anxiety because they cannot understand that their parents will return. Therefore, the parents are encouraged to stay with the child during the hospitalization. Then rapid recovery. After the recovery from an acute illness, children usually return quickly to the normal activities than the adult. The adult may take some more time to get recovery. Then effect of emotion on illness. Emotional stress can worsen diseases such as asthma, eczema and ulcerative colitis. Then stress related symptoms. Stress in children may cause headache, stomachache, leg pain, vomiting, and the common causes of the stresses include family conflicts, inconsistent parenting, sibling rivalry, school problems, pressure from parents. Then behavioral changes. During stress or illness, children may show some kind of behavioral changes like bedwetting, that is enuresis, then soiling, that is encopresis, and then sleep disturbances. That is about the psychological differences. Then we are moving on to the immunological differences. So first one is immature immune system. At birth, the immune system is not fully developed, that I already explained. It continues to mature until about 7 to 8 years of age. It will take 7 to 8 years of age for the proper maturation. Then maternal immunity. Babies receive IgG antibodies from the mother through the placenta. Then breast milk provide IgG antibodies which will protect against the respiratory and gastrointestinal infections. Then increased risk of infection. As the maternal antibody decreases, children become more vulnerable to get the infections like viral, bacterial, fungal and parasitic. Then role of vaccination. Vaccine stimulates the child immune system. In previous classes, I explained about the vaccination. In that, I told vaccine can able to stimulate our immune system and to improve the immunity level. They produce antibodies and provide protection against the infectious diseases. Then development of immunological memory, which means each vaccination or the infection helps the body to remember the organism. So, this immunological memory provides a long-term protection to the child, and the adults also have the stronger immunity because they have been exposed to more infection and vaccines over the time, which means the adult is having more stronger immunity than the children. Why? Because they have been exposed to more infection and vaccines over the time. Then common childhood infections. Children are more prone to whooping cough or the pertussis or diarrhea, ear infections like otitis media, infection or inflammation in the middle ear, then croup and food allergies. That is about the immunological differences. The last one is the social differences. Under the social differences, the first one is self-centered behavior. Young children focus mainly on their own needs. Adults understand empathy and consider other feelings, which means young children focuses mainly on their own needs, but the adults can understand others' feelings and also helping others. Then developing empathy. As the children grow, they learn empathy, social value and acceptable behavior. Then dependence on adult. Children depend on parents and caregivers for protection, decision making, emotional support and medical care. Then different response to emergencies. Young children may cry, scream, freeze or cling to the parents. But the older children and the adolescent often copy the behavior of adults around them. Then difficulty in communicating. Young children may not clearly explain where or how much they hurt. But adults can usually describe their symptoms accurately and clearly. Then legal dependence. Children cannot make medical decisions for themselves. Parents or legal guardians will give consents for their treatment. The need for family support. The presence of parents reduces the fear and anxiety among the children, and family-centered care improves the cooperation and recovery. I hope you all know about the family-centered care. Then that is about the social differences. So, in today's class, we discussed about the mortality and morbidity ratios and also about the differences between child and adult.